Dr. Keith Van Beek, of course, is a fellow Rotarian and runs Jefferson Family Dentistry. So,
Hi, everyone. I have a little PowerPoint I put together that I'll share my screen with here as soon as I get that pulled up. Can you guys see that?
Yeah.
and
That's good, Keith. Oh,
Get some up close and personal teeth pictures today.
that's what you stare at all day.
All day, every day. It's my life. Teeth. Pretty fun stuff. I think so, but I'm kind of a nerd. So yeah, I kind of just wanted to, I was going to do a little update of where we're at and the services and everything that we are doing, and give you some examples of different things. And also kind of we've got some new technology that we're using in the office, which is kind of fun. So I'm going to show you guys that and how that all works. But hopefully it's not too boring for you guys. So this is the office. We have 6 employees full-time and myself right now. So we have 2 up front. Christy, can you guys see my mouse?
Yep.
Okay. So Christy right here. This was a picture we took pre-COVID, had a CE event. This is Christy right here. She's the one up front that you probably see first when you come in the door. Right here is Jessica. She is also up front. So they're the 2 that mainly answer the phones if you call. I got to move these pictures out right here. Okay, here we go. Sarah right here. She's one of my assistants. So when I'm doing fillings and whatnot, she's one of the ones that is helping me directly chairside. My other assistant is Hannah. She's the newest to the team. She's been with us for about a year now. So those 2 help me with direct patient care. And then I have 2 hygienists, the ones that clean your teeth if you come in for a checkup and a cleaning. Kathy and Monica. And then Michonne here, she is a fill-in hygienist for us if Monica or Kathy are busy or out of town or something's going on. Or Monica had a few babies, so she filled in on maternity leave, those types of things. We're open Monday through Thursday, 8 to 5 for patient care. Fridays is kind of my catch-up day on the business side. Bills, taxes, this, that, all the odds and ends that I can't do the rest of the time. So I'm the only one here on Fridays trying to get other stuff done. And somehow I usually start a Friday with a list of things to do, and I do a lot of them. And by the end of the day, my list is somehow longer. So I don't know how that works, but it seems to be the case usually. And if you guys have any questions, any comments at any point, just yell. I don't mind being interrupted. So feel free. So just our office services. Basically, we try to be a one-stop shop as much as we can. We don't want to have to send you somewhere else if we don't have to. There are a few situations where we do still, if needed, but we try to avoid that, because if you have to go somewhere else, it ends up being Des Moines or Ames often. So, you just have to drive. So we try to avoid that. We do the regular cleanings and checkups. Every 6 months is the norm for that. Restorative, that includes all of the fillings, crowns, bridges. Anytime we're trying to rebuild part of a tooth, either because of cavity or if something breaks, that kind of is all covered under there. And then, cosmetic and restorative kind of can fall together a little bit, because sometimes we do restorative work that is also cosmetic work. But cosmetic, including bonding, which is essentially fillings that are, they're white fillings that we can match. We've got all different kinds of shades we can match to your teeth, so that when it's all said and done, it's pretty much you can't tell what is filling and what is tooth. Whitening, you can do over-the-counter whitening with whitening strips. We also make whitening trays that you put gel in, take home. Crowns and bridges again, because I'll show you some cases in a little bit here where it's on the front teeth and it becomes a cosmetic thing. Dentures, full dentures and partial dentures, where maybe you've got a few teeth left, but you want to replace some of them. You can do a partial that comes in and out to replace those. Otherwise, obviously a full denture if you don't have any teeth. Orthodontics, braces, and also clear aligners. So like clear aligners is kind of the generic term for what you probably all know as Invisalign. Invisalign is actually a brand name of clear aligners. Most people just think Invisalign is Invisalign, but they were the kind of the first one to do it. So they've done a good job of marketing over the years to make people don't call them clear aligners. They just say, oh, Invisalign. So they've done a good job. Kind of like, what's another example of that in other areas? Kleenex, there you go. Tissue,
Jello.
Yep, exactly. So yeah, Invisalign is kind of that in that sense, they're a name brand, but they've kind of cornered the market pretty well. There are a lot of others out there, and I'll show you what I use, which is essentially the same thing. It's just a different company. Implants. This is one thing that I do use an outside oral surgeon to help with, and I've got an example of it along the bottom here and on the side, what an implant is. The oral surgeon places the physical screw or implant that goes down into the jawbone. On this left picture, you can see that's when it comes back from the surgeon and it's healed, that's what it looks like to me. And I take it from there and rebuild the top. So there's on this little picture, it kind of shows how you've got the bottom part, which is the screw. We've got this middle part here, which is called an abutment. And on this picture here, this is with the abutment in. There's a screw that goes through this abutment, through this part here, and screws it into the implant and solidifies it. From this point, then it's like another tooth that we put a crown on top of. So it goes from here to this screwed in abutment to the crown or fake tooth on top of that. And when it's all said and done, it's like nothing ever happened. So pretty cool what we can do with that. So moving on from implants, extractions, taking teeth out. We can take out almost any tooth in the mouth outside of wisdom teeth that are impacted down into the jawbone. I save those for the oral surgeons for two reasons. We could do them here, but that's a little bit more intense of a surgery. So most people don't want to be awake for that. So we don't have the ability to fully sedate people in our office. That requires a lot more stuff, a lot more licenses and things like that to fully sedate somebody. So we refer those to the oral surgeon because they will put you to sleep, go to sleep. They do the work, you wake up, it's all done. People like that. And there are certain situations where if it's a single, a regular removal of a tooth, but somebody, is either really nervous about it and they say, no, I need to be put to sleep, then obviously we send them on too. But 99% of the extractions that we see, we do right here in the office. And we do have nitrous oxide, laughing gas, that we can use too. You're still coherent, you're still awake, but it just kind of takes you from a certain level and brings you down, takes away some of the anxiety, makes you feel just kind of extra relaxed, and your inhibitions kind of go to the wind.
So Keith,
So that, yeah, go ahead.
I got a 16-year-old grandson and he just had his wisdom teeth taken out. And
Yeah.
is that pretty much just a thing of course now that they remove your wisdom teeth once you get to be a certain age before there's a problem, or what?
Yes and no. I would say there are some people who don't get their wisdom teeth out and they keep them their whole life. I would say more times than not, they're taken out in that teenage, late teenage, early 20 range. Depends on where they are in development. It depends on orthodontics, braces, do they have room for the teeth or not? What we find is most of the time, our jaws just don't have enough length to really support the wisdom teeth coming in. So what they try to push in from the back, and they cause problems and discomfort. Another thing is a lot of times wisdom teeth just aren't straight. All the other teeth are straight. They come in the way they're supposed to, and then the wisdom tooth is like sideways or backwards or upside down. So obviously they don't do well.
Why don't they call them stupid teeth?
Exactly, right. They're not very wise.
Okay.
That is very true. That's a joke I have a lot of times in the dental office. I've got a lot of dental jokes that really are pretty good. And there's a few around wisdom teeth because the name wisdom teeth doesn't make sense. The reason why they got that name is because if they come in usually around that time, late teens, early 20s, which is kind of your coming of age. You're gaining wisdom at that age, not the tooth itself, but you as a person. So because of the timing of when they come in, that's why they're called wisdom teeth. The teeth themselves are pretty stupid.
I have a friend that is just deadly scared of going to the dentist.
Yeah.
I think a great deal of it, he had a bad experience as a child in a dental chair. Tell how much time you have to spend with some children to make sure they do have a good experience and aren't scared to go back to the dentist.
Yep. So that's something we see every single day. Dental phobia. It's a real thing. Some people it's related to, like you said, a experience as a child often. I don't think that happens so much now because dentistry has changed a lot. But, dentistry 30, 40 years ago was pretty rough and gruff. There wasn't a whole lot of soft teddy bear feely about it. It was lay down and we're going to do this. And there was no sweet talking or anything. I mean, there were some bad experiences for kids for sure. And, I can name on my hand, more than 5 that have a true phobia that we see that is related to an experience from many, many years ago.
I have
And they'll say it themselves. They'll be in there and be like, "I'm so sorry. I can't believe that. I can't believe I get so worked up about this." It's like, it's okay. And they're like, "You're fine. I'm not. There's nothing else. You're not doing anything wrong. It's literally they just have this inherent phobia from a bad experience." So it really sticks with some people. For a long time.
I have another friend who went to the dentist as a young man, and the doctor was a pipe smoker. And the old boy would take a great big old pull on his pipe and then get right in this kid's face and blow out the smoke. And he said, I never Now, they didn't teach that in dental school for sure.
No. Well, I mean, yeah, it wasn't that long ago that smoking was the norm. Doctors, dentists, smoke in the office. No gloves. I mean, even when I was in dental school, there were pictures, they used old pictures for certain things. And, you'd see a picture where this bare finger is pulling the cheek out, You think about that now and you think, oh my gosh, that's crazy. I can't believe they ever did that. But, before the whole HIV thing started and whatever, was that 80s? whenever that was. I mean, before that, that was the norm. Obviously, you know, that that would not be good these days. Plus, it's just kind of, you know, gross. But then it wasn't gross then, you know, that was just the norm. But yeah, we have you know, there are certain people that we don't use nitrous oxide on adults often, only for the ones that truly, you know, need it for those reasons. Kids, we use it a little more regularly. In that 5 to 10 range, you know, if we need to fill some cavities or something like that. They're, you know, generally they probably would do okay, but we don't want to even allow it to be a bad experience. So we use it. And, you know, I think nitrous oxide alone prevents a lot of those bad experiences, because the kids, I mean, I can give injections on kids and they don't even know that I did it, because they're, you know, they're on the nitrous, they're watching a movie on the ceiling, they're just totally in the zone, out of it. And I wiggle their cheek and I say, okay, we're going to squirt a little sleepy water. You're going to feel a little tingle for a second. And it's pretty good. Now, that being said, there are some kids that you can't even get them in the chair. So if it gets to the point where we can't get anything done, even with laughing gas or any of that, we do refer them to a pediatric dentist, because a pediatric dentist, like an oral surgeon, can take them to the OR and actually put them to sleep and do all the work they need to have done. For regular cleanings and checkups, that's not necessary. But if they have a bunch of cavities or anything like that, and there's no way it's going to get done, that is an option. So yeah. Last one there, root canals. We do root canals in the office, most of them. Root canals is very case by case, because the roots and anatomy of the roots on everybody's teeth are very widely, and some of the roots are really curved, or there's multiple roots, and you know, the difficulty level of range varies a lot. So ones that are really crazy, I send off to a specialist who does root canals all day, every day, just because they're used to it. They see them, they do them every day. They're quicker because they do them all day, every day. So straightforward ones we do, but some we do send out. So I'm going to give you guys just some examples of some cases I've done. Some of the things we just talked about, but to show you some examples. So if you look at these left two pictures here, these were crowns. So you can see these two teeth right up front and center here. They have big cracks right down the middle, and the edges of them are starting to break out. So these are teeth that needed crowns, which covers up the tooth and provides protection to it so they don't split in half, and also rebuilds broken structure. So this is how they started, and then after we put the new crowns on, this is how they finished. So these two teeth that I'm on right here are crowned teeth. Those are fake coverings over the tooth, basically encompasses the whole tooth. So through pictures, I can take shade photos. For example, this one right here, I can send these photos to the lab and relay them to them, exactly the colors, the shape, how I want them to make them, and what I want them to look like when it's all said and done. So that's the start and finish of that. This is another case of crowns here, where this is how they started, these top two teeth. This one that I'm pointing at here is a old crowned tooth that you can see the shade just doesn't match the natural teeth. It's been there for years. The gums are starting to pull away from the edge. This tooth is actually one big old filling that's over top of it. Again, the shade over time is darkened. The edges are starting to show along the gums. So this is how it finished. These are two new crowns on these front two teeth.
So Keith, did you do whitening on the rest of the teeth?
And on this left case, no, because
But-
it was a gentleman that didn't care.
But the crown one?
These middle
second-
ones, yes. So what we did is we gave her whitening trays that she wore for about 2 to 3 weeks before we even worked on these teeth. So these two middle teeth, they don't whiten because they're fillings and crowns, but the neighbor teeth, as you can see here to here, they're just a shade lighter. These side teeth, and the bottom one's a little bit too.
Mhm.
So we lighten the teeth next to them first before we do anything. And then when we do these middle crowns, we can match the shade of them to the whitened teeth. So then you get a little more uniform white smile. This right one is a bridge. So here, this tooth here, you can see it's darkened. So this is a tooth that the gentleman had trauma to it when he was a kid. It had a root canal, a post, had a whole lot of things going on. The root was starting to resorb. I don't have the x-ray to show you what that means, but the root was starting to fall apart underneath. So it got to the point where the tooth needed to come out. So we took the teeth out, and then we needed to replace it. Well, there's two ways you can do that: a bridge, like we're going to show you here, or on the last page I showed you that implant. You can do a single tooth implant. The reason we did a bridge here was for two reasons. You can see the neighbor teeth were pretty worn and gouged out. So we wanted to kind of restore the function to those teeth and the shape. The other thing was, because this one had so many issues with the root, there was a big defect in the jawbone there when we took it out. So you can kind of see that there, how it healed. There's this big defect. So to try to put an implant in there, there's not enough bone. So for those two reasons, we did a bridge instead, where we shaped the tooth. So this is, if you were to see a middle picture of these crowns, this is kind of what it is. We shape the tooth down, remove any cavity, make sure we're on good solid tooth. This was the shade picture we took for it. And then when he comes back, this is a new tooth, this is a new tooth, and this is a new tooth. There is no root underneath this tooth here. That's this space. This is essentially a crown over this. This one's a crown over this, and then this one is connected in between it. So this is one solid piece of three teeth that slides down over the top and is glued down on these two, and it essentially bridges the gap between them. So, you know, there's still a gap under here that he has to clean underneath, you know, on a regular basis if food or stuff gets underneath it. But as you can see, from start to finish, that's a nice turnout. And he's got his tooth back. The infection and whatnot was going off. That tooth is gone. So it's kind of a win-win. Any questions on any of that kind of stuff?
Keith, the whitening process, how much money can you invest in that? I mean, I see kids that look like they never drink coffee, wine, or anything. Their teeth are just pure white.
Yeah, that's kind of the new norm. So natural teeth have a little bit of, you know, color to them, a little bit of a yellow hue. Stark white is not necessarily natural, but that's what Hollywood has come to show. Like, that's the norm. That's what people want. So whitening, you can go as much or as long as you want to. You know, some people's teeth whiten better than others. It just depends on the structure of the teeth. Usually you can get a little bit of whitening, but I mean, you know, so she here, this one, she can keep whitening more and more and more on these teeth over time if she wants to. You know, you can whiten as much as you want, as long as you want, and they kind of just become a little more opaque and a little chalkier looking white over time, to the point where they look like chiclets. But you know, over time, that'll, you know, as you drink coffee and do all those types of things, you know, and naturally just food, they will start to darken slightly over time again, but then you can just whiten them again later. So it's kind of a case by case, how long you want to do it and how often. So so this is what, you know, bonding. So these are fillings. They're basically tooth colored bonded fillings. These are a few different cases of mine that I've done that I had pictures on. So this lady here came in, she had chipped these three front teeth. We use those little tabs to figure out an exact shade match. And then from there, we bond and rebuild these teeth to rebuild the structure and even them out. And this is a before and after of this case. So these are just fillings on the edges to replace that tooth structure. If we go up here to the top right, another situation, a broken tooth bit into something, it was cracked already and knocked off that entire chunk of tooth there. Again, rebuilding over here. If you go to the right, the final gums are a little red because this was right after we got done with it. You can, you know, some teeth are easier than others to shade match because the fillings are one solid shade, whereas the teeth, oftentimes, even the same tooth has many different shades within it. So the materials we have now, we can get pretty darn close 99% of the time. You know, if you look really close at this picture, you can kind of see where the transition from tooth to filling is. But to the naked eye, if you saw this person and they smiled at you, you'd have no idea that that is not a natural tooth there.
That would be if they didn't have their mask on.
Yeah, yeah. That's funny you bring that up. So we have, you know, we have certain cases where, you know, people have something broken or they're in between procedures and they're missing teeth. You know, normally that's a pretty big deal, but right now they're like, oh, I just wear my mask everywhere, so it's not a big deal. So in the dental world, some people have been thankful that they have to wear masks because they don't have to worry about showing
Yeah.
off their teeth. And then here's just another example, a chipped tooth. Right along the edge there, before and after, same thing, matched the shade, bonded it on there, shaped it, polished it, and can't really tell anything was done. So braces, orthodontics, this is kind of my baby. I did a lot of extra training to do this, and I've been doing it now for 3-4 years now, maybe total. I didn't do it for maybe the first year I was here in Jefferson, but I've been doing it ever since. This is just one of my cases, to kind of show, you know, what's possible. So this young gal, very, very nice looking young gal, but you know, she just hated her teeth. You know, and obviously you can see there's a lot going on. You can see this tooth is completely blocked out. It's tucked behind these teeth. They're uneven, they're not centered. So she had a lot going on. Bottom teeth very crowded. So this is a situation where we had to take teeth out. So if you go from this picture to this picture, you can see we pulled this tooth out and we pulled this tooth out. What we did was we put a spring, that was to create space to unravel the crowding and also put a spring in here to separate these two teeth out so that we could then attach to this one and pull it into the bite. On the bottom, you know, we took out 2 teeth as well because of the crowding. If you go to the next step here, this is, you know, again, partway through treatment. You can see that now this tooth is already in. This was the tooth that was tucked behind. It's in there. And now we have these big springs right here. And that's partly how we close the space. So we have these stiff wires. We straighten everything, level it, and then we put these stiff wires in, and then we can put these springs in from the back to the front teeth. And we can use varying level of forces to either pull these teeth forward or pull these teeth back. And we did the same thing on the top, but the space is already closed there, so there's no spring in there now. And then you can see from the top view, you can see how we've already, from here to here, we've straightened, we're closing the spaces. And then obviously the final, how the girl left. So it was like those teeth were never there that we took out, and everything's straight and aligned, and she's ecstatic. And this girl, I think we got her in, we took them off on a Friday, and she had her senior pictures the next day.
Oh.
So she was pretty excited. So yeah, I mean, this is a pretty, not all cases are this involved. This is kind of a fun one that required a lot of different aspects to do, but you know, going from start to finish, I mean, it was 2.5 years, so it's not an overnight thing, obviously, which you guys all know, but it's pretty fun to see the changes that can happen. And then I was going to talk about clear aligners a little bit. Here's just a video. This is the Clear Correct, is like an Invisalign. It's a name brand. That's the kind we use here, but it just kind of goes through briefly how they work and gives you a good view of them.
Clear aligners work like any other orthodontic appliance. They apply pressure that gradually moves the teeth and reshapes the supporting bone. The process is fairly simple. First, the doctor captures the shape of the patient's teeth by taking impressions or scans. The doctor prescribes how the teeth should be straightened and submits the case to ClearCorrect. Based on the doctor's instructions, ClearCorrect creates a series of virtual models of the teeth, progressing from crooked to straight. These models are printed on a 3D printer and used to create clear plastic trays called aligners. The patient snaps the aligners onto their teeth and wears them all day and all night, taking them out only to eat, drink, and brush their teeth. The aligners are clear, so most people don't even notice them. Each aligner applies light pressure to certain teeth, pushing them closer to the desired position. Let's take a closer look at how this works. Each tooth is surrounded by a periodontal ligament. This ligament is surrounded by fluid and tiny fibers that connect the teeth to the surrounding bone. As soon as the aligner is put on, it immediately starts applying pressure to the targeted teeth. The fluid in the periodontal ligament prevents the tooth from moving at first, but within a few seconds, the fluid is expressed from the area, and the tooth moves to its new position. The ligament is only about 1/4 millimeter thick, so the teeth can only move a tiny distance at a time. The pressure from the aligner compresses the blood vessels on one side of the ligament and dilates them on the other. After 4 to 6 hours of sustained pressure, the compressed ligament responds to this stress by producing enzymes and chemical messengers. After a day or two of pressure, those chemicals begin to stimulate the production of bone cells called osteoclasts and osteoblasts. Osteoclasts break down the bone near the compressed ligament. Meanwhile, osteoblasts build new bone on the opposite side of the tooth, preventing it from becoming too loose. If the pressure of the aligners is interrupted for any significant length of time, the process has to start over from scratch. That's why it's critical to wear the aligners at least 22 hours per day, especially for the first few days of a new step. If the bone doesn't get reshaped, the teeth won't stay straight. When the bone around the tooth finishes rebuilding, it's time to take out the old aligners and move on to the next step. This rate of rebuilding can vary considerably between individuals. It usually takes longer for adults than it does for children and adolescents. Each aligner moves the teeth a little bit further until the patient gets to the last step and the treatment is done.
So that just gives a nice overview of how that works, and it got a little scientific there for a little bit, but generally speaking, putting pressure on the tooth and holding that pressure is going to make that tooth move slowly over time. So if you would even take your finger and put pressure on one of your teeth and hold it there, if you could hold pressure on it nonstop for that many hours straight, that tooth would move. Obviously that's impossible to do, but regular braces work the same way. It's just you're just fixated to the teeth with brackets and wires. So, it's that constant low force that over time moves the teeth where you want them to go. So the concept of how the teeth move is the same. It's just the aligners do it a little bit differently. And you're also at the mercy of making sure you wear them to make it work. Like it said, braces, you can't take those off. So the pressure is constantly there. But aligners, if you don't wear them enough, they won't work. So it's a nice option. It's a nice option for some people.
Bands and wires.
Say that again, sorry.
Do you still use bands and wires
With
old-fashioned braces?
With the aligners, you mean? Or
no, in another treatment, as another.
Yeah. Oh yeah. We do that all the time. Just like that case I just showed you.
Yeah.
We actually do more standard braces than we do aligners.
Mm-hmm.
Aligners are awesome, but they do have some limitations. Because you're not fully fixated to the tooth, some of the forces and turns and torques you want to do, you can't do as effectively. With braces, you're stuck on the tooth, so you can really put the pressures you want to make them move the way you want, much more efficiently. But the downside to that, obviously, is you have braces on. And for kids, it's normal. It's okay. They don't care. Parents don't care. But, young adults, they want to straighten a few teeth, but they don't want to wear braces. That's where clear aligners oftentimes are a good option. Or somebody who had braces as a kid, they didn't wear the retainers, a few teeth kind of twisted or moved a little bit. Clear aligners are a good way to just kind of tighten that back up. So
is the clear aligner adequate? I'm thinking of an athlete in football. If you've got to keep them on all the time,
yeah,
wear them with a mouth guard, or that is adequate to have the clear aligner in?
You probably would want to take them out for that time period and wear an actual mouth guard, because they'll hold the teeth in place, but they're not gonna have that same force. You know, if you got hit hard, it's not gonna have that the
Protection.
ability to take that force like a soft mouth guard would. They're not as thick as that. So you know, there's obviously with kids, there's some limitations. If you have braces on, you know, we have kids all the time are in sports and they wear braces. There are some mouth guards that kind of fit over top of braces. They're not as form fit, but they do cover them and prevent contact from breaking them off or knocking the teeth together. So, so yeah, clear liners, because they require more compliance. Kids, we don't use them near as much because kids by nature aren't as compliant. You know, we see it alone just in brushing their teeth. You know, it's hard enough to get them to brush their teeth sometimes, let alone wear this tray nonstop for, you know, 22 hours a day. So, but adults, and the other thing is they're not paying for it. You know, they don't have the same value in it. Their parents might yell at them, but they don't care. Whereas, you know, a young adult who's paying for them themselves, they're like, well, I'm paying for it. I'm going to make sure I, you know, get value out of it and it does what I want it to do. So it's a good option for certain situations, but also limited for some. We don't need to do this again. Hold on. There we go. So the last thing I want to talk about is digital scanners. So this is kind of my new technology I have in the office. How much time we got? Am I going long? Got a few minutes. Okay. Called digital scanners. So this is the tried and true impressions. If any of you guys have had them before, it's a big tray full of goop that you shove in there and try not to gag, right?
Yep.
Nobody likes it. It's a mess. It's a mouthful. So that's the standard way to capture a model of what the teeth are specifically. Well, what we can do now with new technology is we have a scanner like this little wand here that it takes pictures of the teeth, many pictures over time as you go around and scan the teeth, and it populates it digitally on the screen. And it's an exact replica down to the littlest amount. It's almost more accurate than actually taking a physical mold of the tooth. That's how good the technology is. So we have one of these now where we don't have to use this near as much. There's certain situations we still have to use it, like for dentures, but for crowns and all those things I showed you, we can take scans of the teeth and send it digitally to the lab, and they can make the crown right off it just through a digital file, and it fits better than even if we take a big goopy mold like this. So it's pretty amazing, the technology. It's obviously it's nice to not have to do this. That's easier for the patient, and we can do a lot of different things digitally with it that we can't do the standard way. So we use these for crowns. When we take molds for braces, all that kind of stuff, we use this instead, which is good because most adults, even if they gag, we can, you know, talk them down and control it. Kids, we've had kids throw up in the chair because of molds like this. It's not fun. So if it doesn't happen all the time, but you know, 1 out of every 15 or 20 probably, which is too many. You know, kids hate it because once they start feeling a little bit of that gaggy feeling, you know, it doesn't matter what you say to them, they lose it. So this is really nice for that. And then this next page, I've got a little video. This is actually the digital scanner I have. It's a quick video that kind of shows what it is and how it works too. So that the video is a little dramatic, but we don't have that music in the background when we're doing it at the office, but it kind of gives you a little bit of an idea of how, how that works. It's pretty cool, and we're learning a lot with it. We just got it, I think in November. So we've been using it a lot, and it's working really well, and it's added a lot to the practice, and we're enjoying it. It's always fun to have a new toy, right?
Well, Keith, you sound like you have to be part engineer to be a dentist. Is that kind of the case?
Yeah, somewhat. There's a little bit artist, a little bit engineer, a little bit electronic guru. I mean, there's really a lot of different aspects to it. But that's what I love about it too. And I love that every day is a different day. I could be doing 10 different things in the same day. So it keeps me going. Some days are a little more monotonous than others, but I feel like I'm kind of a lifelong learner. With even the braces, now this digital scanner, like now I'm thinking about, in 6 months to a year, what's going to be the next thing,
Yeah.
what am I gonna pursue to add to the practice or learn about? Because there's so many new things out there, and it's constantly changing that if you don't, you're gonna fall behind. So yeah, I'm a little bit of a dental nerd, I would say. So with that being said, I think we're getting down there. Does anybody have any specific questions or comments or anything dental or non-dental related?
That led to average $2.15 per pound. There were 57 antidotes at the auction, which saw.
So yeah, dentistry is definitely not like it once was. Even since I graduated in 2013, a lot of things have changed. So it happens pretty fast with new technology and everything going on.
I hope you're doing at least annually talk to the high school kids about
High school, I
dentistry.
have some classes, like they have some, I don't know what the classes are called, some sort of career type classes.
Exploration.
And I have a few kids, kids that are interested in that reach out and come and shadow, follow me for a morning or a day, ask me a bunch of questions.
Good.
We get a handful of those every year. I don't physically go to the school and talk to them as a group, but if they show interest, then we set up something for them to come to me. There has been a couple middle school classes that have come out to the office as a whole class and kind of same thing, show them around. I've gone into elementary, that's more of the less career and more, this is how you brush your teeth. But that's fun too, because usually they're the ones that are most excited about stuff when you get those kindergarten, first, second graders. So yeah, it's obviously this year has been a little different with COVID, but hopefully once this all continues to die down, we can go back to doing some more of that kind of stuff. So
Keith?
Yeah.
Who works on your teeth?
Good question. I have some friends that are dentists that if I need something, I can call them. I still have the hygienist who can clean my teeth, and they can kind of look them over, and they'll take x-rays of my teeth so I can look at my own teeth on x-rays. But if I actually physically need something done, then I'd have to call up a buddy and plan like a Saturday or something to go see them. And I will say, I haven't had any cavities recently, but I get cavities too, just like everybody else.
Keith,
So
I think
I'm not immune to it because I'm a dentist.
I think I didn't realize how much of a business you've got going there with 6 full-time employees. Did you have any training on the business end of it while you were in dental school?
Zero. It's that's one of the biggest learning curves along the way has been not doing dentistry, but how to run an office, how to manage people, how to have employees, systems, marketing. I mean, that's what my Fridays are a lot.
And just keeping
That kind of stuff.
payroll and taxes, that's,
Payroll, taxes, yeah. I mean, the list becomes pretty long. But you know, it's now that I'm in year, what is it, 5? April will be year 5 here in Jefferson. I mean, you know, there's always something to deal with or new to learn. But I feel like I'm, you know, getting a little bit more of a handle on all that aspect. But yes, that's doing dentistry itself is the easy part of my job, really. But it's yeah, it's all constantly learning. That's for sure. I've been very blessed with my staff. Really haven't had much turnover at all since I started. I've just added. And you know, I wouldn't be where I am today without my staff, for sure. I've been very blessed in that because, you know, when I first came here, you know, it's a smaller town, smaller area. You don't really know, you know, who you're going to have apply or who's going to be available. Because it's kind of, it's unique. It's a unique position. Not just anybody can jump in and, you know, do it with ease. Obviously hygienists, they go to school for multiple years. They have to have a degree. Assistants, there is assistant schooling. That's about a year long to get registered right out of it. You can have somebody apply and work for you that has 0 dental experience and train on the job to be a dental assistant. But that comes with its caveats too. And they're not allowed to do as many things. And so, but there's different ways to, and you know, when I've hired people at the front, you know, it seems like it's just a standard receptionist job. Well, it's hardly that because you're dealing with insurance. You have to know the lingo of teeth and run the system that we do it on. So I mean, it's not just answering phones, for sure. So yeah, without my staff, I'd be lost.
Keith, what percent of your patients have dental insurance, and do you recommend it?
I would say probably about 75 to 80% have dental insurance. And there's a lot of different insurances out there. There's different private insurances that people have through their workplace. That's most common. There's state insurance, Title 19. We do see children up to the age of 18 with state insurance, but we do not accept it for adults just because we don't have the capacity to do that. And in state insurance, the reimbursement on state insurance barely covers my bills. So it's more of a, I do it for kids up to 18 as a service more than from the business side of it. But that's why I have to kind of limit that to a certain extent because, you know, I on certain things, I lose money just by seeing them because the reimbursement rates are so low. Private insurance is better. If you don't have private insurance through a employer, there are individual plans you can buy. But you have to be careful too, because some of them, what you pay in premiums, you don't really get that much value back out of them. So I always tell people that are thinking about it to talk with Christy up front because she's the insurance guru. She can evaluate each, because there's tons of different plans. It's not just one out there. She can evaluate them individually and say like, no, it's not really worth the premiums you're going to pay to even have it. So it's again, it's a case by case situation, but having dental insurance, I mean, can be a large benefit for sure. Especially if you get it covered through, you know, an employer or something like that. I mean, it's definitely because all your cleanings and checkups and regular stuff are all covered usually at 100%. And then if, any work needs to be done beyond that, there's different percentages of copays and things like that. So, yeah, did that answer your question?
Yes, thank you. Mhm.
Okay. Any other questions?
Keith, the only thing I'd add to your slides, if you could come up with some of the worst mouths that have
Oh,
been seen in dental school, tobacco chewers, and
oh
people
yeah.
never
I've
brush
seen,
their teeth. And this is what it looks like, kids.
you guys would probably cringe if you saw some of the things I've seen. It's and that's not just in school. I mean, you'd be surprised around, see it everywhere. Sometimes the most put together people, visually, hygiene, have the worst teeth. It's so weird. It makes no sense. They're pampered, whatever, dress well, everything clean and cut, and then they open their mouth and you're like, this doesn't match. But it's all over the place. I mean, every day is a new adventure. But that's what I love too, a lot of people are embarrassed to come to the dentist for one thing or another. And I always tell them, I'm like, doesn't matter, the condition we're in now or in the past, whatever, you're here now. We're going to do what we can to get you where you want to be, to either rebuild your smile or make it healthy or whatever we need to do. It's a no judgment zone for sure. But a lot of people feel that way when they come to the dentist that they haven't been in a long time. So, got to break down that barrier sometimes, because 9 times out of 10, it's not as bad as they think it is. and then the ones that are really bad, they don't think it's that bad. It's always the opposite. They go like, oh, I just got this one tooth that's a little rough up here, and they open their mouth and every tooth is broken off. It's all over the place, but it keeps me on my toes, and that's what I love about dentistry. No one day is the same as another. So, any other questions or anything I can? Hopefully it's been a little bit interesting, or you learned a little something today. Not everybody gets too excited about dentistry in general, so hopefully I gave you a little something to think about. So
Great
You're
job.
a great asset to our community. I'm glad you live here.
thank you. Yeah, we no regrets. When we came here about 5 years ago, we didn't really know much about Jefferson. We kind of just took a leap of faith, and no regrets at all. So
And you're nice to have in the neighborhood.
yeah. Did you see the kids playing on the big snow pile yesterday?
I did. We were having fun.
Oh yeah, and it finally wasn't 10 below, so we could actually go outside and do some of that.
I saw you give one of the kids kind of a little heave ho into the
Into the
pile of
snow. Every time I do some of that, they're like, do it again, do it again, do it again. Never ends, but it's fun. So, all right. Well, thank you guys.
Thank you, Keith.
Thank you, Keith.
And if you ever have any other questions, reach out, email, whatever. I'm always here. I'm willing to answer any questions you might have. So